So today we're going to be looking at some microbiology concepts for USMLE and NBME, and this will primarily involve step 1, and it will also incorporate some of the step 2 concepts as well. So if you're an aspirant for step 2 and you want to refresh your memory for the basic microbiology concepts, you can also do that. Now, basically all of these things are not tested individually on the paper, but they help you build your foundation in order to understand the bigger concepts in the future. So basically this lesson would cover your first aid microbiology pages of from 123 till 124 for first aid, and also some UWORLD and NBME concepts are also incorporated in the lecture. So let's begin. So series of cases will be presented to you and reasoning will be provided for you to best understand that question. Now, which of the following stains would best visualize this organism on histology? A 34-year-old man presents with burning epigastric pain that worsens on an empty stomach and improves with meals. He reports similar episodes in the past and has been self-medicating with antacids. Upper endoscopy reveals multiple duodenal ulcers, gastric mucosa, biopsies performed to identify the underlying pathogen, which is a spiral-shaped urease-positive bacterium. For microbiology and infectious module, you need to understand that there is certain information that you must memorize in order to understand bigger concepts later on. Right? So basically this information right here is important. This is basically describing certain bacterium, and you have to remember certain descriptions of certain bacteria. Right, so I'll give you a minute to choose your answer. Okay. So basically GMSA stain is our answer. And the organism that they described as being spiral-shaped urease positive gram-negative rod is Helicobacter pylori. Helicobacter pylori is basically the main infectious organism that is involved in peptic ulcer disease. The peptic ulcer disease can occur for other reasons as well, but the most common reason is due to H. pylori. They also can call this organism as being comma-shaped, like a comma. So being comma-shaped, they can refer to this organism. So what it basically does, it colonizes the gastric antrum and increases the gastric acid production to decrease the somatostatin that is released from these cells and predisposes to duodenal cells. So what basically somatostatin does is that it dulls the HCl, and the gastric acid is prevented from being harmful to the lining of the stomach. It doesn't really do any damage, but if somatostatin is decreased, so it cannot neutralize the acid anymore, and in result of it, you can basically get ulcers. And duodenal ulcers is one of the highlight of peptic ulcer disease. You can also get duodenal ulcers by gastrinoma, which is a gastrin-producing tumor in the pancreas. So you can get that by gastrinoma. The main site of ulcers primarily caused by H. pylori is basically the antrum. But you can get them anywhere, and you can get them in duodenal. So duodenal enteral ulcers are pathognomonic for H. pylori. But you must remember that duodenal ulcers also are related to gastrinoma. So what the GM stain will basically show you is that the bacteria will stain as blue-purple, and it will be clearly visible as being comma-shaped. So they do give you a histo picture, which unfortunately I do not have with me right now, but they do give you a histo picture, so make sure to review the picture from the internet as well. The histo picture is important. So you can use GM sustain for Plasmodium, Chlamydia, Borrelia, and Trypanosomes. This is basically a short high-yield mechanism that is summarized in this short flow chart, which is that H. pylori releases urease because it is a urease positive organism. What it does is it increases the production of ammonia, which neutralizes the acid. And in this neutralization process, mucosal damage occurs. What it does is it results in formation of ulcers. If this process is not stopped and the treatment is not followed, what can happen is gastric adenocarcinoma and malt lymphoma. Malt lymphoma is especially associated with H. pylori. This would result as a final consequence. This is the long-term result of not treating peptic ulcer disease, H. pylori infection. So you can get gastric adenocarcinoma and malt lymphoma. Other stains are also useful. Silver stain is mostly useful for Legionella and Bartonella. The PES stain is basically used to stain the glycogen and polysaccharides. For Trophaema vipli, we use it classically. We can also use it for some fungi. Z-Nelson stain is classically used for Mycobacterium and Nocardia for acid-fast organisms. And Indian ink is used for Cryptococcus. So a 29-year-old man presents with painless genital ulcers that resolved spontaneously. He is now undergoing serologic testing for suspected syphilis. Initial screening tests are positive. Which of the following specialized staining methods is used in the confirmatory step to visualize the causative spiral sheet? So I'll give you a minute to solve this. Right. So fluorescent antibody staining, the FTA-ABS is basically known as treponemal test. So there are two kinds of tests that you must know about. There's a non-treponemal test. There is a treponemal test. All right, what the non-treponemal test contains is basically it contains of VDRL. It contains of VDRL. And it also contains of rapid reagent testing. These two are basically used for screening. So they are not specific for syphilis. They are used as screening methods. So in the question, they've already told you that the screening is positive. So what you need to do is now confirm the infection. Once the screening is positive, you now need to confirm the infection. To confirm it, you will do treponemal test. So treponemal test is FTAVS, which is an important treponemal test you must know. This is a confirmatory test for syphilis. X antibodies against treponema pallidum, and which is a thin spiral-shaped spiral sheet. So this is another spiral-shaped organism. And you must know this description. This is very important. This organism is not visible on ground stain. You must know this also. So this basically stain binds to the pallidum organism and it visualizes it under the fluorescence microscope. The important part you must know is that the primary syphilis is caused and occurs in 3 stages. The first one, which is the primary syphilis, basically gives results to the painless checker that heals spontaneously. So the screening test, as I've explained to you. Also, anticardiolipin antibodies can be found in syphilis. So you must know that. The confirmatory test is FT-ABS, obviously. These other stains are also given, as in the previous slide. All right, so which of the following is the most likely positive organism? So the 62-year-old man undergoing chemotherapy presents with persistent cough, fever, and shortness of breath, unresponsive to broad-spectrum antibiotics. Chest CT shows nodular infiltrates with surrounding ground glass opacities, which is better known as halo sign, and the sputum cultures are negative. Ground stain is inconclusive. A silver stain of bronchoalveolar lavage fluid reveals branching filamentous structures. So basically, they're saying which organism are they talking about. You must understand, again, that the descriptions are very important, right? Culture negative and ground stain is inconclusive. Silver stain is used. Branching filamentous structures. So you must understand that this is important. So this organism is Aspergillus fumigatus, one of the most high-yield organisms on the exam. Basically, this is an opportunistic organism. It is seen in immunocompromised and neutropenic patients. Diabetic patients also, you can see that because diabetes is a sort of an immunocompromised state. This causes invasive aspergillosis, which presents with fever, cough, hemoptysis, and nodular infiltrates with halo sign. And the silver stain, which is also known as Gamma methylamine silver, you must know the alternative names also. It basically shows the septate hyphae branching at 45 degrees. But you must know that direct, in contrast to this, there is mucormycosis, which you will see its branches in a 90-degree angle. That also causes invasive disease in diabetic patients and immunocompromised patients. But getting back to Aspergillus, it causes three main infections, which is the most dangerous one is the invasive aspergillosis. Second one is ABPA, which is mostly involved in asthmatics and CF. You don't really need to be immunocompromised for this infection. And aspergilloma is an asymptomatic infection. It can reside in the old TB cavity. This organism is identified by silver stain. Mycoplasma pneumonia is not identified on gram or silver stain. Tuberculosis is identified by Zealand stain. Chlamydia is seen with GM sustain, as we studied before. And Cryptococcus is seen with Indian incormulki carbide step. All right, so what is the most likely reason for ground stains failure? The 25-year-old man presents to the clinic after noticing a painless genital ulcer that developed 10 days ago. He denies dysuria or penile discharge. Physical exam reveals firm, non-tender canker. Dark field microscopy and fluorescent antibody testing are pending. Gram stain fails to visualize any organism from the lesion sample. So the answer is that it is too thin to be visualized by a light microscope. They're asking about the reason for gram stains failure. And this reason is important because more and more questions are conceptual based rather than being too memory based. So they're testing out your concepts. Basically, why the Treponema organism is not visualized on the gram stain is because it is too thin to be seen with the standard gram stain. It doesn't really take up gram stain well, so it cannot be visualized by gram stain. Instead, it is visualized by the dark field microscopy or the FT-ABS. So this is basically a serological test, and this is a microscopic test which visualizes it. The FTABS detects the antibody. It's logical. Dark field microscopy can only visualize the syphilis organism, and it can only be visualized if a chancre is present. If the chancre is present, the dark field microscopy can be used to visualize the organism by taking a sample of the chancre. It causes a painless chancre, which is involved in primary syphilis, and it is a gram-negative organism. It has a thin peptidoglycan layer, which also adds more to the reason why it cannot take the gram stain. Right, so, it is an intercellular pathogen. This is wrong because chlamydia and rickettsia intercellular pathogens, and pallidum is not intracellular. And it has a peptidoglycan layer, albeit a thin one, but it does have a peptidoglycan layer. Mycoplasma, on the other hand, lacks a peptidoglycan layer. C, it has a high myconic acid content. This is in Microbacterium species, not in Treponema species, and contains dense glycogen granules. This is pathognomonic for Chlamydia trachomatis, not for Treponema. Right, so which of the following pathogens is most consistent with this finding? So 48-year-old man with AIDS, and he has a CD4 count of 80, presents with cough, pediatric chest pain, and weight loss. Chest imaging reveals cavitary lesions in the upper lobes. Bronchoalveolar lavage is performed, and Ziehl-Neelsen staining reveals weakly acid-fast branching filamentous organisms. So the following pathogens most consistent. Right, so remember the description of the question, and it is nocardia. So why nocardia? Because nocardia is weakly acid-fast, and it is aerobic, so weakly acid-fast and branching filamentous gram-positive bacteria. So it causes pulmonary, CNS, and cutaneous infections, especially immunocompromised patients. It is weakly acid-fast, so it is not as acid-fast as tuberculosis, but it has some component of being acid-fast. It has some mycolic acid component in its cell wall, although not as strong as the tuberculosis organism, but it does still have that. The high-yield infection that it can cause is pulmonary nocardiosis, which is resembling TB. It is limited to the pulmonary system, but if this is uncontrolled, it can spread to the CNS, causing brain abscesses and cutaneous nocardiosis. So cutaneous nocardiosis occurs due to the bacteria entering the skin after any trauma and can cause a cutaneous lesion. And it is treated by TMP-SMX. It's important. So you must remember the mnemonic of SNAP. So basically, it compares nocardia and actinomyces. And what it tells you is that which organism is treated by which medication. So TMP-SMX is used to treat nocardia, and the P, which is penicillin, is used to treat actinomyces. So you can remember the mnemonic SNAP to help you remember the association. And this is important. You have to remember all of this description and the medication that is used to treat this. It also comes in the step 1. A little description about the other organisms, such as Borrelia recurrentis, is also spirochete that causes relapsing fever. This is not important for step 1. Neisseria meningitis is a Diplococcus organism. It can be seen on gram stain. It's not acid-fast. Legionella is gram-negative rod. It can be seen with silver stain only and not Ziehl-Neelsen stain. Cryptosporidium parvum can be seen as oocysts because it is a parasite. It is a fungus, sort of a fungus. So it can be seen as oasis in stool. They are, however, acid fast. You must remember the cryptosporidium is acid fast. You must remember that. This is important. Right, so TB, Locardia, and cryptosporidium, these are acid fast. All right. The question already gave you this hint that Zeal Nelson reveals acid fast organisms. So you can narrow it down to these two, figure it out from there.